All right, today we're putting on our detective hats to solve a pretty fascinating medical mystery. The crime scene? The human gut. And the case we're trying to crack is what happens when your body just can't get the fuel it needs from the food you eat. So let's start gathering some clues.
I mean, really think about that for a second. Imagine eating a full meal, but you still feel weak, tired, and just unwell. It's a super frustrating and confusing situation, but for some people, it is their daily reality. And this isn't about the quality of the food, not at all. It's about a fundamental breakdown in how our bodies are supposed to process it.
So the heart of our investigation is this condition called global malabsorption. To put it simply, the small intestine, which is supposed to be this incredible nutrient-absorbing machine, just kind of stops working the way it should. And when you can't absorb vitamins, minerals, fats, and proteins, well, that kicks off a whole cascade of problems throughout your entire body.
Now, we've identified three main suspects behind this absorption problem, and each one has a very different motive and method. We're going to be opening up the case files on celiac disease, tropical sprue, and the much more elusive Whipples disease to figure out how they operate and, more importantly, how you can tell them apart.
Okay, let's start with our most well-known suspect, celiac disease. You've almost certainly heard of it, but the way it works is a classic case of mistaken identity and, friendly fire happening inside your own body. So it all kicks off with one single trigger, gluten. For most of us, it's totally harmless, but in someone with celiac disease, the immune system sees gluten as this dangerous invader and launches an all-out attack. The real problem here is that the battlefield is the lining of your own small intestine.
This internal battle leaves behind a whole trail of clues. Because you can't absorb nutrients properly, you might see things like iron deficiency anemia. The damage can even mess with the nervous system, causing a loss of coordination called ataxia, or nerve issues in your hands and feet. And of course, you've got the classic digestive signs like steatorrhea, which is basically fatty stools, just another big sign that nutrients are passing right through instead of being absorbed.
But the definitive evidence, the smoking gun, comes from a biopsy. And there, we find something called villus atrophy. Okay, imagine the inside of your intestine is like a plush, shaggy carpet with millions of tiny fibers called villi that grab all the nutrients. In celiac disease, that immune attack flattens the whole carpet into a smooth, hard floor, which, as you can guess, dramatically reduces its ability to absorb pretty much anything.
And this isn't just some localized crime scene. Celiac is often found hanging out with other autoimmune conditions. We see clear links to a specific skin rash, type 1 diabetes, and a few others. And that tells us this is a systemic issue, not just a simple gut problem. All right, let's move on to our next case and see how this all compares.
Our second suspect, tropical sprue, is really defined by its geography. As the name suggests, this one's a bit of a world traveler, but it only really shows up in very specific destinations.
Now, unlike celiac's autoimmune trigger, tropical sprue is thought to be caused by an outside agent, an infection. So after a visit to a tropical region, an overgrowth of certain bacteria can damage the intestinal lining, which then leads to long-term malabsorption.
The key clues here are pretty distinct. First, that travel history is absolutely essential. Second, while celiac often just targets the first part of the small intestine, tropical sprue tends to affect the entire length. And this leads to a huge diagnostic clue. A severe deficiency in folic acid is a hallmark of this condition, often right alongside a B12 deficiency.
And now for our final and maybe most mysterious suspect, Whipple's disease. This one is a true master of disguise. It's a rare condition that can affect nearly any part of the body, which makes it incredibly difficult to track down.
The culprit behind Whipples is a very specific bacterium, Trophorema whippli. So this isn't an autoimmune reaction or a simple overgrowth. It's a direct, systemic invasion by a single type of bacteria.
The investigation here often starts with clues in the gut and the joints. Patients might have chronic diarrhea and abdominal pain, but a really telling sign is migratory arthralgia, that's joint pain, especially in big joints like the knees, that seems to just move from one joint to another.
But the investigation gets way more serious when we see how this disease spreads. This bacterium can travel to the heart, causing a type of valve infection, and, most alarmingly, it can go to the brain. In fact, the most common sign in the central nervous system is a rapidly progressive dementia. But Whipples has a telltale signature, a nearly unmistakable clue if you know what you're looking for: oculomesticatory myarrhythmia.
Yeah, it's a mouthful, I know. But what it is these rhythmic, involuntary movements of the eyes that happen while chewing. It is incredibly specific to this disease and a total dead giveaway for a trained detective.
The final absolute proof comes from another biopsy. Under the microscope, you can actually see the bacteria, stained bright pink with a special stain called PAS, hiding out inside the body's own immune cells, the macrophages. They've essentially been Trojan horsed right into the system.
All right, we've gathered all the evidence on our 3 suspects. Now it's time for the lineup. Let's put them all side by side to see how their profiles really stack up and how we can make that final correct diagnosis. See, when you place them next to each other, the key differences really pop out. Celiac is autoimmune. The other 2 are infectious. Celiac hits the first part of the intestine, while Sprue and Whipples affect the whole thing. The key deficiency to look for in celiac is often iron. In tropical Sprue, it's folic acid. And Whipples, well, that's defined by its wide-ranging multi-system attack. And this all points to very different treatments, a diet for one and specific antibiotics for the others.
And ultimately, getting the diagnosis right isn't just some academic exercise. It's a matter of life-changing treatment. I mean, think about it. Misdiagnosing an infection like Whipples or tropical Sprue as celiac means that patient would never get the antibiotics they desperately need. Each mystery really does require its own unique solution.
So, we've cracked this particular case, but it kind of opens up a much larger line of questioning, doesn't it? The gut is this incredibly complex universe, and its health is so deeply connected to everything from our immune system to our brain. These 3 conditions, they're just a glimpse into that world, reminding us of just how many more mysteries are still out there waiting to be solved.